Hi, it's Dr. Mark here from Apunapima. Look, there's just a couple of messages that I wanted to get out to our families and people and communities in Cape York and the Torres. And I think they're really important things for us to think about at this time. The first is the concerns about the coronavirus and where we're standing with all these kind of things. Just remember, from our community's perspective, we've been around for 100,000 years. We've been through worse than this before. We've survived bullets, poisonings, diseases, and extremely bad policy. So we can get through this the same as we have in the past. But we did that by pulling together and doing things our way. And I think we need to go back to thinking about how we manage this ourselves as well, as opposed to just waiting for governments and expecting other people to help us. There's so many things that we can do ourselves in our communities. And if you think back, you understand when there was enemies or when there was something happening, it was always the men that were outside protecting. Inside that line were the women, and inside that were our elders and children. And we need to continue to do those kind of things. Take care of our oldies, take care of our children, and our men need to be the protectors for our communities once again. And when I say that, I don't mean they're out there with spears, but I mean our men's groups, etc. Now's the time to organise yourself. You know, are there people, old people that need food runs? Are there people that are by themselves? Are there single mums trying to struggle through this by themselves? There's lots that we can do. We just need to reach out. This might be a matter of, the men's group talking to councils about what they can do, but there's no reason why you just can't go out, identify people, the pensioners and stuff like that, and start doing what we do, what we're meant to do as cultural people. And inside that circle of men that protect our communities, and that's what we culturally do, are our women, who are the most beautiful, resilient, dignified women in the world, I think, and have been the bedrock of our communities forever. You just need to do what you've been doing forever, and that is persevering and doing what you do in the face of adversity, which you've always done. And so continue to do that, and we'll be okay if we do our roles. And I have to say, look, our culture isn't about hoarding food or fighting over stuff. Our culture is about taking care of our communities and ensuring that the older people and our kids are really protected and taken care of, and that's us. So let's not be like the rest of the population and doing like crazy stuff in shopping centres, etc. Let's take care of each other the proper way, cultural way. That's what makes us Indigenous, and that's what makes us different from other people. Just remember that coronavirus thinks it's deadly, but we're deadlier. So we got to stick to the ways and social ways and cultural ways we know, and protect each other, take care of each other. There's a few subgroups as well that I think we need to really look at around protecting and risk activities and stuff like that, and I'll talk to some of those as well. So things that we do, like sharing, we may have to really rethink. So sharing cigarettes, sharing drink bottles, all those kind of things. Plastic cups are cheap. Don't be sharing those kind of things anymore. Utilise other things like plastic cups from the shop or wherever. People that smoke ganja in bongs and stuff like that, I know that's illegal, so nobody does it, but if you happen to do that, it's not good to share. Those kind of things are out now, so sharing those kind of utensils, anything like that, don't do it. Things like getting together in gatherings, playing cards and stuff like that, which is good social stuff generally, but look, at the moment, those kind of groups may be counterproductive, particularly if it's different families getting together, At the moment, with our social spacing, or what we're calling it from health professionals, that may not work that well for some of our communities, because as you know, we have big families and small houses, but at least at a household and family groups, we might need to stick together a bit more rather than interacting out more. So those kind of things, look, think about it if you've got colds and flus and issues like that. Think about it as if you're a smoker. Go outside and cough and splutter in places where there's no other people, and keep that kind of distance, especially around those things. Continue the hygiene measures that we've been talking about. I have to say, to our mayors and our leaders in our communities, I think you've stood up better than any other leaders in Australia. And I can tell after doing the teleconferences that our mayors really care about our communities. So listen to them and their directions around travel restrictions and our councils, etc., because they're leading better, I think, than the rest of Australia. So just want to thank you, and maximum respect to our mayors that do a good job and generally don't get thanked for anything, because I know you do care. There's also a couple other tips I might be able to give you around hand hygiene, etc. I was told yesterday that COVID-19 rhymes with come on Irene. That's been in my head ever since, so I'm putting it on you guys now, so it's in your head, but just think about that. You've got to hand wash for a certain amount of time, so make sure you do that effectively, especially after you've coughed and those kind of things, and in between rooms and households and people, if you do have a cough or a flu.